afternoon, and thank you for joining us on Across the Fence. I'm Jolie Whitney. Have you or a loved one sustained a TBI or a traumatic brain injury? It's likely that you have, because in the U.S., the CDC estimates that between 1.7 and 3.8 million Americans experience TBI each year, and only 10% of those injuries are sports-related. To talk TBIs, brain health, and how to protect your noggin, I'm joined by Dr. Kalev Freeman. He's a physician-scientist whose research focuses on inflammation and injury to small blood vessels after a brain injury. He serves as an associate professor of emergency medicine and pharmacology and leads his own lab at UVM's Larner College of Medicine's Department of Emergency Medicine. He and his team conduct cutting-edge research aimed at helping trauma patients. Welcome.
Good morning.
We're happy to have you. First, let's start with brass tacks. What is a traumatic brain injury?
A traumatic brain injury, or a TBI, is defined as any blow to the head which results in altered brain function. And it can be a blow from a jolt, a fall, or any other mechanical injury.
All right, and to follow up on that, and correct me if I say this wrong, what is a trauma-induced coagulopathy?
Yeah, thanks. One thing that many people don't know is that the leading cause of death after any severe injury, TBI or others, is actually bleeding. And many patients with severe injuries, such as a TBI, develop something like hemophilia, where they cannot make a blood clot. And as you can imagine, this makes it very hard for surgeons and physicians taking care of the patient to help them in the recovery. So this is what one of the things that my lab focuses on is trauma-induced coagulopathy.
And you're the principal investigator on a recent $12.4 million grant from the NIH to study trauma. So what are you doing with that?
Oh, thanks. I can just say that to receive federal funding for a research project that we designed and will conduct here at the University of Vermont, Larner College of Medicine, is one of the great privileges and honors of my academic career. And with this particular project, this is a multi-center, 5-year award that will focus on trying to understand the life-saving potential therapeutic value of plasma transfusion, which is when you take the plasma from a healthy human and transfuse that into a trauma patient. And we know from our work with our prior grants and from our team that plasma transfusions can help improve recovery and survival in all trauma patients, and in particular, those with traumatic brain injuries.
Sure. So for people at home, and also myself, who's never really clear on this, what's the difference between blood and plasma?
Good question. Blood contains products which are separated during the Red Cross process into different components, which include red blood cells, platelets, and the plasma itself, which is the serum, the growth factors, and the material that seems to be most beneficial in recovering a trauma patient.
Sure. And is a concussion a TBI?
A concussion is a type of TBI. It's within the same spectrum. Historically, we've considered concussions as the traumatic brain injuries that we cannot see with CAT scans or typical radiologic imaging. With more modern imaging technology like the MRI, we can actually see evidence of concussions. So we now consider concussions to be mild TBI or mTBI within the same spectrum of a brain injury.
So during the study, what has been your most significant finding?
We've got two accomplishments that I'm particularly proud of. One of them is understanding the process by which small blood vessels become inflamed in trauma. And when we think about small blood vessels, there's almost 60 trillion miles of capillaries and small vessels that go through the body, which are interconnected. 60 trillion cells that are connected in a network throughout the body, which it's like a layer of saran wrap, or imagine Teflon coating, so that the blood doesn't clot in the wrong spots. And when you have severe trauma, that inner lining of the blood vessels can become deranged or actually fragmented, contributing to altered blood clotting in our trauma patients. So understanding that biology has been one of our major accomplishments, and really recognizing that no matter how much blood you transfuse a patient, you have to protect the blood vessels themselves to improve recovery. And I would mention our other finding is with regards to clinical management of trauma patients, understanding the optimal methods for resuscitating trauma patients in terms of diagnostic testing and blood transfusion products is part of the work for my team.
Sure. So in lay terms, can you explain kind of how a blood transfusion can help somebody with a TBI?
Sure. And again, this is surprising because most people with TBIs are not bleeding. So to think that we would give them a blood transfusion was a bit counterintuitive. But from large studies of early resuscitation, giving people not a bag of IV fluid that has saline or salt water, but actually giving them plasma as the therapy helped survival in trauma patients. We were able to show that, and specifically the patients with traumatic brain injuries were the ones that were most likely to survive. We think that the reason for that is because we're protecting the small blood vessels from that inflammation that drives coagulopathy or bleeding problems.
And this is obviously impacts a ton of people across the country, but how does it help people specifically in Vermont?
There's, I think, a couple ways that helps Vermonters. One is that here at the University of Vermont Larner College of Medicine, our team is by engaging in cutting-edge research, we're also practicing what we preach. And so I think our trauma teams at the University of Vermont are exceptional and provide exceptional care. So when you go to the trauma center for an injury, and actually that applies throughout our network, because now that we're a part of a health network, those research findings have translated into clinical care. The other major feature that I think we should mention is that the National Institute of Health and federal funding for scientific research actually creates jobs here in Vermont. So our multi-million-dollar grant awards provide my salary support, and as well as the support for salary members of people in my lab.
Sure.
So, and also trainees, students, medical students, postdoctoral scientists.
Absolutely, high tides raise all ships.
Exactly.
And I think you said a little bit before, and it's definitely an experience I can share. I know I've maybe hit my head skiing a couple times. So do helmets really help prevent concussions like that?
Great question. We know from research that's been done here in Vermont at the Sugarbush Ski Clinic, and also in New York and other places, that helmets do not prevent mortality. They don't prevent death. So the number one cause of a fatality when skiing is skiing at a high speed on a blue, maybe not a black slope, and hitting a tree at high speeds. And helmets are not going to prevent that. So it's really important when you're out skiing to ski in control your edges, and the helmet is not going to be a miracle, but the helmet can prevent a concussion. And so I think the smaller injuries, the fall from height when you hit your head on the snow, or hard-packed Vermont mogul, perhaps, having a helmet can really make a difference and help you recover and avoid a more serious concussion or brain injury. But again, don't expect a miracle, and it's important to ski in control.
Absolutely, good advice all the time. And like I already mentioned, skiing and seeing those numbers, you'd assume maybe it's a quarterback who's always in the news for having a TBI or something like that. But the numbers kind of indicate that it's a larger range of people in the U.S. So what's happening there?
Sure. Well, the most common causes of head injuries are probably falls, particularly in the elderly. But there is one particular area of head injury that I would like to highlight, which has increased recently, including in our area, and that's increase in emergency visits, hospitalizations, and traumatic brain injury from electric bikes and other or micro transit options, particularly when bikes are rented without helmets. The majority of operators who rent electric bikes are unhelmeted. And between 2017 and 2022, JAMA Surgery published a report showing almost a 30-fold increase in hospitalizations from e-bike use. So I think people should be aware that if you're renting one of those bikes, they may be fun, but bring a helmet.
Sure, yeah, absolutely. And maybe they can go a little faster than your regular foot-powered bike, too.
Yeah, and who knows when the brakes were checked.
Absolutely. And we talked a little bit about the numbers, but are those all evenly reported? Do some people just never go to the hospital for it?
We have less information on those unreported mild injuries, concussions. And in fact, most adults who have concussions do not present to the emergency room. So the data we have is for the more severe injuries.
Okay, but that means maybe you got a concussion and you didn't go to the hospital, and that means our numbers are a little low.
Right.
And so how are the blood vessels in the brain kind of changed after a TBI?
Well, the inner lining of those blood vessels, which I mentioned is like Teflon and helps keep blood flowing, also plays a really important role in regulating barrier function, which is keeping the fluid inside the cells, and also in the direction of the blood flow to send blood to areas of the brain at the time when it's needed, which is what we call functional hyperemia. And when that endothelial lining of the small blood vessels is altered, then the brain can't direct blood to the regions that it needs to. And also, if the barrier function isn't maintained, then fluid will leak out into the tissue, causing what we call edema, or swelling of the brain. And that's, in fact, that swelling that occurs 2 or 3 days after a concussion, which is, again, edema or swelling, is one of the major reasons people get headache and confusions 2 or 3 days after a concussion, because that swelling process takes a few days to resolve.
Sure. And how long does that damage last? Is it permanent?
That's a great question. We don't know.
Oh.
We do think one of the areas of research for our lab is that we do believe that these small blood vessels that control blood flow, the changes that we see in the acute setting after brain injury may contribute to long-term sequelae.
Sure.
But that's the area that's less well known. And another area that is interesting to us, but not as well known, is the effect of serial injuries, whether it's multiple concussions from skiing or blast wave exposure for an industrial or military personnel. Serial blast waves can also cause similar changes in the brain that are much less well understood.
All right, we're almost out of time, but I want to ask, what are you guys learning from your research to help develop interventions so TBI patients can survive more?
Well, the main area of interest right now is the therapeutic value of plasma resuscitation. Healthy human plasma from healthy human beings, has a major benefit in patients with traumatic brain injury. We'd like to know why.
Sure.
And if we can figure out why, then we may be able to devise a drug or a pharmaceutical target that can do the same effect.
Sure. And why is UVM's recent R1 status so important to your work?
The University of Vermont achieving R1 status is a testimony to the amazing research at our institution, and also lets us join a cadre of the premier research institutions in the United States. It brings recognition to our work, helps us recruit both faculty and students, and I think it gives us more as faculty members, it gives us more confidence that we're participating in great work here.
Absolutely. Thank you so much for joining us today.
My pleasure.
And if you'd like to learn more about TBI's intervention and prevention, you can visit the website on your screen. And always remember, give blood, or I guess in today's case, plasma. And that's our time for today. I want to thank the crew behind the scenes here at WCAX. I'm Jolie Whitney. This is Across the Fence. Have a good one.